Good morning, task force members. I am bringing you greetings from the healthcare subcommittee. I am unable to be with you again this morning because we're having our second graduation for the undergraduate students on the campus of Tuskegee, and we're trying really hard to stay safe while we're over there, but want to make sure that you had your COVID-19 update in my absence. The other members of our committee did meet on Friday, and I'm sure they probably have already given that update. So I'll just go ahead and get started. So looking at COVID-19, my slides don't want to cooperate. Let's try going this way. Nope. Okay. May 7th, this is our COVID-19 update. Sorry about that. Looking at the trends from around the United States, we continue to see a pretty significant uptick in the number of new cases that are recorded each day. This data is current through May 4th because there's a one-day lag, and I'm recording this on May 6th. And so this would have been pulled this morning, but it would only be recording what was available through May 4th. So the number of new cases on May 4th were recorded at 100,839 new cases in the United States overall, with a 7-day moving average of new cases of over 64,780. Looking at admissions, which is the indicator that the CDC is focusing on to determine community spread, we also see a significant uptick in all ages across the United States, with a 16.6% increase in the number of hospitalizations in the United States for the past week. Looking at that more specifically for our region, which is Region 4, and this is this corner of the United States, we've had for ages 18 through 29, there's a 10.9% increase in hospitalizations. And this is significant because this is usually the age group that will normally just may get COVID, but not really see many hospitalizations. But this is a percent change from the previous week. The age group that had the least amount of increase over the last week, and this data is good through May 3rd, was the age group 50 to 59 with a 4.6% increase in the number of new admissions of patients confirmed with COVID-19. The age group 60 to 69 in Region 4 had 11.4% increase in hospitalizations. And the largest group, of course, being in the age group over 70 in Region 4 with a whopping 27.5% increase just over the last week. So just as we've noticed with the other waves of COVID-19, when the spring hits and we start to relax mitigation, you start to see those numbers move again. Bringing this a little bit closer to home, we're looking at the state of Alabama. And as it was all blue just a few weeks ago, we're starting to see some yellows and a lot more orange of that is substantial increase in positivity for certain corners of the state. Fortunately, right now, Macon County does remain at moderate, but for the state overall, the percent positivity as of May 5th is at 5.2% positivity for the state. Looking at Macon County specifically, is at 3.1% positivity, which leaves us at moderate for the coming week. But with the trends that have been recorded, I think we'll probably stay moderate, if not flip to substantial over the next week or so. Looking at hospitalizations, as of May 5th, there are 62 COVID-19 hospitalizations. If you'll just recall from last week when I did this recording for the subcommittee, we were at 52. So that's 10 new hospitalizations this week that are related to COVID-19. And again, as we look at the different waves that have occurred since the beginning of the pandemic, we're beginning to see the pattern exist where we have a downtrend in early spring, somewhere between March and April, And then we start to see that trend starts to go back up in the late spring, early summer, June through August. And so we have to stay cognizant of the fact that just like with the flu, there are seasons of COVID-19, and usually they coincide with relaxing our mitigation strategy. So I want to just continue to encourage folks to stay vigilant. Please wear your mask. Because of the lifting of many mandates, you will find when you go into public spaces that you will not have a lot of people that are mitigating. But because of the way data is being reported right now, and we're only really showing hospitalizations, and according to CDC, we're still at low risk because of the hospitalizations in the state of Alabama overall. Many people are not as focused on COVID-19, but that trend is changing. And as you can see, the percent positivity rate is going up pretty quickly. I want to talk about a few hot topics that are happening around COVID-19 this week. The news cycles are looking at hepatitis and COVID-19. This is looking at it from a world perspective, where we've had several countries to report over 165 cases, and these are childhood cases of hepatitis. And they're looking at the links with COVID-19 because of the age. The average age of these cases are between 2 and 5. So these are not associated with vaccines because vaccines have not been made available to that age group largely around the world and or in the United States. But there is some connection that they're starting to see in the data, especially in the data they look at the UK, where most of the cases that were of hepatitis also had COVID-19. According to the CDC's news release that just happened about an hour ago, there are 109 children across 25 states and territories in the United States that have been found to have hepatitis due to an unknown cause. It's still under investigation. Adenoviruses are one of the targeted culprits that's been investigated, but also the connection with COVID-19. Alabama is one of those 25 states. 90% of the children have been hospitalized, and 14 have had liver transplants of those 109, and 5 children have died thus far. The other hot topic for COVID-19 this week is that the FDA released on yesterday its recommendation that the Johnson & Johnson vaccine only be given to adults who cannot receive a different vaccine or specifically request J&J's vaccine. They have been looking at it for months, the life-threatening blood clots that are associated with the with this particular vaccine. And so they actually just made this recommendation on yesterday. And although they've been recommending that Americans get Pfizer or Moderna shots instead of vaccines prior to that, they clearly made the recommendation on yesterday that they should not be given Johnson & Johnson vaccine if there's another alternative because of the life-threatening blood clots that are associated with this vaccine. So that's all I have for our update this week. I hope that it was informative, and I apologize for not being there to answer any questions that you may have, but I will be back next week. And I hope that you are having, for all the mothers that are on the call, hope you have an awesome Mother's Day and are able to get some rest. Thank you.